Pharmaceutical powders are an essential category of pharmaceutical dosage forms. They consist of finely divided solid particles. These particles contain active pharmaceutical ingredients, which are the medications. Powders may also include inactive ingredients called excipients. Excipients serve various functions. They can improve the powder's flowability, stability, or taste. Pharmaceutical powders are versatile in their applications. They can be administered through various routes. These routes include oral, topical, and inhalation. The choice of administration route depends on the specific medication and its intended therapeutic effect. Powders offer a convenient and effective way to deliver medications for a wide range of medical conditions. Pharmaceutical powders are an important area of study within pharmaceutics. Pharmaceutics is the science of dosage form design. Understanding the properties and characteristics of powders is crucial for developing safe and effective medications. Factors such as particle size, flow properties, and stability must be carefully considered during formulation development. The versatility of pharmaceutical powders allows for tailored drug delivery. This means that medications can be designed to release the active pharmaceutical ingredient at a specific rate or in a particular part of the body. This level of control is essential for optimizing therapeutic outcomes and minimizing side effects. Overall, pharmaceutical powders play a vital role in modern medicine, providing a flexible and adaptable platform for drug delivery. Pharmaceutical powders can be administered through various routes, each offering unique advantages depending on the desired therapeutic outcome. Oral administration is a common route for powders, where they are ingested either directly or mixed with food or water. Antacids, used to neutralize stomach acid, and laxatives, which promote bowel movements, are examples of medications commonly available in powder form for oral administration. Topical powders are formulated for application to the skin. These powders are designed to be homogeneous, meaning they have a uniform particle size and distribution, ensuring consistent application and drug release. They are also typically irritation-free and possess good flow properties, allowing for easy spreading and even coverage. Topical powders may exhibit adsorptive properties, meaning they can attract and hold substances on their surface, or absorptive properties, enabling them to draw in and retain substances within their structure. These properties make them suitable for treating a range of skin conditions, wounds, and mucous membranes. However, it's important to note that topical powders are generally not recommended for areas with high liquid exudate, as they can form a crust that traps moisture and hinders healing. Inhalation is another route of administration for pharmaceutical powders, primarily used for respiratory conditions like asthma. In these cases, the powder is delivered directly to the lungs using devices like inhalers or nebulizers. These devices aerosolize the powder, creating fine particles that can be easily inhaled and deposited deep into the respiratory tract, ensuring efficient drug delivery to the target site. Dental powders are specifically formulated for use in the oral cavity. They are often incorporated into toothpaste and mouthwashes for cleaning and treating teeth and gums. Abrasives, which are substances that can mechanically remove plaque and stains, are commonly found in dental powders. Insufflations are another specialized form of powder administration. In this method, the powder is delivered into body cavities using an insufflator. This device blows a stream of air, carrying the powdered medication into the targeted cavity. This method is used for local drug delivery to areas like the nose, tooth sockets, ears, vagina, and throat. Pharmaceutical powders offer several advantages over other dosage forms, making them a popular choice in various medical applications. One significant advantage is their versatility in terms of dosage adjustment. Unlike tablets or capsules, which come in pre-measured doses, powders allow for easy dose modification. This is particularly beneficial for patients who require individualized doses based on their age, weight, or medical condition. Another key advantage is the ease of manufacturing pharmaceutical powders. The production process is relatively straightforward and cost-effective compared to other dosage forms. This simplicity in manufacturing makes them an attractive option, especially for large-scale production and distribution. Moreover, powders offer enhanced stability compared to liquid formulations. Liquid medications are more susceptible to degradation and microbial growth, which can shorten their shelf life. In contrast, powders have a longer shelf life, making them a more practical choice for storage and transport, particularly in areas with limited refrigeration facilities. Furthermore, powders provide a larger surface area for drug absorption compared to tablets or capsules. This larger surface area allows for faster dissolution of the drug in the body, leading to quicker therapeutic effects. This rapid onset of action is particularly beneficial for conditions requiring immediate relief, such as acute pain or allergic reactions. Section 4. Particle size and classification. Particle size plays a crucial role in determining the properties and behavior of pharmaceutical powders. It influences various factors, such as the powder's flowability, dissolution rate, and even its therapeutic efficacy. The United States Pharmacopoeia, or USP, has established a classification system to categorize powders based on their particle size. According to the USP classification, powders are grouped into categories ranging from very coarse to very fine. Very coarse, particles greater than 1,000 microns in size. These powders have the largest particle size and are typically used in applications where slow dissolution is desired. Coarse, particles 355 to 1,000 microns in size. Slightly smaller than very coarse powders, they are still relatively large and often used in topical preparations. Moderately coarse, particles between 180 microns and 355 microns. These powders have an intermediate particle size and are suitable for various applications, including oral and topical formulations. Fine, particles between 125 microns and 180 microns. With a smaller particle size, fine powders are often used in suspensions and emulsions for their ability to remain dispersed in a liquid medium. Very fine, particles between 90 microns and 125 microns. These powders have the smallest particle size and are commonly used in inhalation products due to their ability to reach deep into the respiratory tract. The particle size of a powder can be determined using various methods, including sieving, microscopy, and laser diffraction. Sieving involves passing the powder through a series of sieves with progressively smaller mesh sizes, separating particles based on their ability to pass through. Microscopy allows for the visual examination of particles using a microscope, providing information about their size, shape, and distribution. Laser diffraction measures the angle at which light scatters as it passes through a dispersed powder sample, allowing for the calculation of particle size distribution. Section 5. Types of pharmaceutical powders. Pharmaceutical powders are broadly classified into several types based on their intended use and route of administration. Understanding these classifications is essential for selecting the appropriate powder formulation for a specific medical condition. Oral powders. These powders are designed for oral administration and are commonly used for medications that need to be dissolved or suspended in liquid before ingestion. Examples include antacids, laxatives, and electrolyte supplements. Oral powders offer the advantage of easy swallowing, especially for pediatric and geriatric patients who might have difficulty swallowing tablets or capsules. Topical powders. Formulated for application to the skin, topical powders are designed to be non-irritating and possess good adhesion properties. They are commonly used to absorb moisture, reduce friction, and provide a protective barrier on the skin. Examples include antifungal powders, antiperspirants, and wound dressings. Inhalation powders. These powders are specifically engineered for delivery to the respiratory system using inhaler devices. They are commonly used to treat respiratory conditions such as asthma, chronic obstructive pulmonary disease or COPD, and pulmonary infections. Inhalation powders offer the advantage of targeted drug delivery to the lungs, minimizing systemic side effects. Dental powders. Primarily used in oral hygiene products, dental powders are formulated to clean teeth, remove stains, and promote gum health. Abrasives, such as silica and baking soda, are commonly found in dental powders to aid in mechanical cleaning. Insufflations. These powders are administered into body cavities using an insufflator device. They are used for local drug delivery to areas such as the nose, ears, and vagina. Insufflations are particularly useful for treating conditions such as nasal congestion, ear infections, and vaginal yeast infections. Section 6. Conclusion. The significance of pharmaceutical powders. Pharmaceutical powders hold a significant place in modern medicine, offering a versatile and effective means of drug delivery. Their diverse applications, ranging from oral and topical administration to inhalation and insufflation, demonstrate their adaptability in treating a wide array of medical conditions. The ease of manufacturing, cost-effectiveness, and enhanced stability compared to other dosage forms further contribute to their popularity. The ability to tailor particle size and thus control drug release and absorption highlights the versatility of powders in pharmaceutical formulations. This level of control allows for optimized therapeutic outcomes while minimizing adverse effects. As research and technology advance, we can expect to see even more innovative applications of pharmaceutical powders in the future. The continued development and refinement of pharmaceutical powders will undoubtedly lead to improved drug delivery systems, ultimately benefiting patients worldwide. From treating common ailments to managing complex diseases, pharmaceutical powders will continue to play a vital role in advancing healthcare and improving patient outcomes.